Here, hold these. Hey, welcome back to Teaching Tuesday. I want to talk about gynecomastia, or man boobs, or moobs, whatever people call it. And they want to know what operation we do. Well, it really has to do with how severe the gynecomastia is. What am I talking about? Well, some people just have literally some fat excess, or oftentimes young guys will have a little breast tissue right under the nipple-areolar complex. It's not really obvious, but they just have projection. Maybe it's obvious under a tighter shirt, and that makes them uncomfortable, or maybe in a bathing suit. Just a little extra projection like that. That's just the easiest thing, because we can do a little liposuction right in that area. Generally, young guys, the skin snaps back. Easy fix, like 30 minutes or so. Sometimes, though, there's a lot of extra skin that needs to be taken out, sort of like a breast reduction. But there's an in-between case that I want to talk about where the skin's droopy, but it's not so much that it's like a female breast. It's just the nipple's a little low, maybe guy's a little older, and the skin's a little loose. So what we do is around the areola, we make another circle above it and cut out the intervening skin, and then have sutures that we sort of pull like a purse string, and it tightens up, lifts the nipple into position, and then takes out some skin, just like we do on some women's sort of mini lifts. So it's like a mini gynecomastia lift. And then in the most severe cases, like this poor young guy, we're actually reducing a lot of breast tissue, and there's so much skin excess. Even in a young guy with tight skin, we have to remove it. Here he is only about 6 weeks after surgery. You can see he's going to have a scar underneath, and his nipple-areolar complex has been moved up into a higher position. So what kind of case do we do for gynecomastia? What kind of surgery? Really depends on how severe it is.